Asia Pacific, compared to many other regions of the world, is aging very rapidly. The transition from an aging to an age society in several countries of the region is taking less than 20 years. And this is different from what happened in the global north. And it also has implications for policymakers because they will have less time to adjust and adapt policies to address the challenges and opportunities of population aging. In fact, in Asia Pacific, we often say that countries are growing old before they're growing rich. So that is a dilemma, and that's what we're trying to address collectively.
Across Africa, the populations are young, yet aging faster than anywhere else in the world. By 2050, Africa's older population will triple to over 220 million. And over 80% of all our older persons will be living in low and middle income countries, with Africa and Asia carrying the largest share. This means that aging is not a northern issue. It's actually a development and equity priority.
One of the things we did this year in particular, which has been very impactful, is rallying other organizations who work in the interest of older persons. And we call this network NOTE. This is a network of organizations for the elderly. And during the World Elder Abuse Awareness Day, for example, we came together, we worked with other people, and we had the same message. We shared platforms on social media, TV, radio, and we used the opportunity to share, the same advocacy message. And it really gave us a lot of, strength, in that unity.
The Thar Desert of India is the most densely populated desert ecosystem in the whole world, and a large number of rural communities are living in this area under great food and water shortages, impacted by droughts, severe poverty, and poor health conditions. And out of all people living in this area, older people are the most impacted, are the most vulnerable. In the leadership of older people and with the support of intergenerational learning exchanges, we are addressing a social development challenge in this particular area, which is basically droughts and climate change. And the solution that we are offering is led by the communities. And again, older people are the main leaders of the program that we are doing. They are the beneficiaries as well as the key contributors.
We believe in a life course approach to poverty eradication. This approach recognizes that young people's experience of poverty change as they move through different stages of life, from childhood to youth, adulthood, and old age. And it calls on us to design interventions that support young people throughout that journey. So Youth Build then steps in at one of the most critical moments, the transition from adolescence to adulthood, when many young people risk falling deeper into poverty because of interrupted schooling, unemployment, and social exclusion.
Under the project, 92 champions from 14 senior citizen daycare centers were trained. These daycare centers are community spaces where older people gather and spend their day in social activities. Champions of different age groups were trained on self-care practices, including nutrition, hygiene, physical activity, mental well-being, disease prevention, elder abuse, and more. So to ensure the continuity beyond the project period that is going to finish this November, we advocated with local government bodies. We conducted orientation session on aging issues for the local government. We convinced them, follow up with older person FCSVs and community nurses. As a result, all participating wards have now committed to continue the monthly health screening program using their own resource.